if law enforcement or fire service was that fragmented, somebody would long ago said, wait a second, we've got a private police department, we've got a volunteer police department, we got a full-time police department. That isn't gonna work, but we've accommodated for EMS. The communities have said, well, we've got to be neighborly and help, and we've just accommodated. And the problem is, we don't have the people anymore that want to do that.
And so we have 26 firefighters and about 12 EMTs. And there's several of us that are EMT and fire. And call volume wise, probably 300 calls EMS, probably 50 calls on the fire department end. But, you know, as far as per se me, I'm also the fire chief, so I got to choose my battles. I have to be the fire chief per se in an accident. I can't take over patient care at a certain time unless I have coverage for doing that. So, you know, we don't have to always choose our jobs, but they have to fill in, and you got to be lucky enough to be the time of day, what the call is, who's available. You know, logistics become a big part of it, and there's no two calls the same.
Our lift assist calls to go to people's homes have quadrupled in the past 4 years. And people don't have the family ties. You get in that whole social structure on why you know, they don't have their brother, son, daughter, neighbor that they can call and say, come and help dad. They don't have that anymore. So they'll pick up the phone, call 911. And they all, or a lot of them, believe it is a full-time service that people are just sitting there, just waiting to come to your house.
One thing they haven't mentioned, it magnifies significantly in the summertime, and the volumes are just so huge in trying to staff that. So you may go from 15 runs to 40 runs a month. So the problem's really magnified during the summer.
I guess I want to kind of dovetail on what the doc is saying. In Bayfield County, 51% of our homes are second homes. Over half the homes in the county, second largest county in the state, are second homes. They're paying taxes, property taxes, but they're not providing people to help augment the volunteer services. And on any grant we apply for, it's based on your census population. Doesn't take into consideration the Burka binder, which affects the southern part of our county, the Apple Fest this past weekend, extra 50,000 people we just moved into the county. None of those numbers fit into anybody's grant.
Coming from the educational portion of it, because I do both full-time, so I teach full-time and I work the service full-time.
Yeah.
The basic class doesn't qualify for financial aid. So if it's just one of us just going in because we want to help our neighbors, we want to help our community, it's $1,200 plus registry out of pocket unless you get your service to pay for it. I have students that end up withdrawing because they realize that they aren't really going to quote unquote make any money doing the job, so they can't afford the $1,200 startup fee basically.
And for us, in the educational side for the WITC is being in the northwoods of the district, you know, my counterpart is based out in Richmond. His stockpile of instructors is huge. And I'm the only instructor to cover one of the 4 counties of my area right now.
As one of our fire chiefs, and the fire chief of Mason said, when you try recruiting people and you ask them, you know, do you want to do this? Everybody virtually says, I don't have time. And Kevin said, and neither do we. You know, we're the same hours allotted to us every day as everybody else. So something gives for the volunteers. Family time or work performance. And then there's this tendency, well, then maybe we need to look at going career full-time. And the cost of that, I think, at least for our area, I'm not sure how they will ever do that. So our next solution is delayed response. Instead of an ambulance coming from 12 miles away, it might be 20 more miles away. You know, we got it covered. We didn't miss a call. The person died, but we got there and we responded.
Sawyer County is new full-time staff. They're new since May 2017. The county board, along with the public safety board, county board members decided that, you know what, we're just not getting the volunteers anymore. We have to do something to be able to cover our, you know, our citizens. So they decided that they would take it on and go full-time. We have 2 full-time sites and we have 2 volunteer sites. Now, sitting at the Public Safety Board meeting that I was just at last week, they went, yep, we're probably going to go, yep, we're going to vote, you know, hey, we're going to increase this. We're going to stay in behind it because we need this level of care. We want this service for our county.
In our last 12 students, we got 2 through to the national registry. And so it's not a very good, and we're paying their way. But just can't get them, you know, everybody involved on the same level to get it done. And I don't know what the answer is, but it's not, the system's not working at the educational level from our aspect anyways.
Things have changed. Attitudes have changed, mentalities have changed. I've been through the whole volunteer system, and I still volunteer on a lot of things. But volunteerism is unfortunately in EMS, and whether it be because of the education demands now, because of the time demands, because people just don't want to volunteer anymore. Unfortunately, that's a sad state and thing to say, but it's true. And like I said, and that's a small community, and the town I live in is still volunteer service, and they're constantly trying to stay in service because they don't have the personnel. And you can only do that so long, or only do that until you don't show up at certain so-and-so's house because you don't have a truck, or that truck is coming from, St. Croix Falls up to Frederick, which is about 30 miles. It's not going to be long before people are like, hey, wait a minute. But unfortunately, it's getting to that point, at least in my area.
It'd be nice to see income tax waivers for volunteers that are getting volunteer money. There's no real tax incentive for any business to permit its employees to go to volunteers for daytime coverage, our worst coverage time. There's not an incentive for any business to let their employee go, other than just a plaque at the end of the year and thanks a lot.
My son is a perfect example. He's 19 now, he's going to college. But he got a job at Quick Trip in Rice Lake, making $12 an hour, $12.50 an hour. So we talk about money coming in there with no education. And you can work there without any education really, versus our EMTs coming in at $14 an hour even, with all the education they have to have. So that's where the shortfall is, and to get someone to volunteer for nothing basically, and still have that same education as somebody that's really only making this much money, and then compared to somebody who can go work at Quick Trip, nothing against people, I love Quick Trip, but you can go work at Quick Trip and make, if you work the overnight, it's almost $13 an hour, I think.
People don't realize also that volunteerism is really just a coined term. It's a 24-hour day, 365 job that you take on. What's the career span of an EMT anymore? 5 years, 3 years, 5 years? So you're washing them out because you're burning them out. They're trying to cover these calls because they want to do best for their community, but basically, God bless you full-timers, but you take your pager off at night or you punch out and you go home and you go you run your life. But as a volunteer, you know that in the back of your mind, your pager's going to go off, or something's going to be a call and you're going to leave, and you're just never really off.
Has anybody brought up the fact about the National Registry problem that we've had? Well, I've been an EMT for 24 years, and I'm nationally registered. I recently retired, so I don't have a Wisconsin license, but I'm still nationally registered. And that was a component that came in, that's a required component now for EMTs and for EMRs. We had 5 EMRs that came in and went through the training and passed all the tests, and were really excited about being on the service, but they had to take, for a Wisconsin license, they had to take the National Registry, and they didn't do very well because the questions, and here's one of our EMRs that did pass on the first time, and the reason she did is she's an RN.
So I've been a nurse at St. Luke's Hospital for 18 years, and actually their Iron ambulance saved my life 2 years ago. I had massive PEs, and if they weren't there, I would have died. So I'm on that because I'm trying to give back. went through the classes as well. Actually, there was more. I think there was 8 of us actually in this class. And we did all the testing, all, you know, the hours that we had to do. And I think out of those 8, only 3 passed the National Registry. And there's a couple of them that have taken it 3 times and have still failed. And obviously 3 times, then you don't, I mean, you have to take it over and again. Anyway, so they're not doing it, obviously, because, you know, the sad thing about me, or this, as a nurse, you're not gonna get volunteers with this National Registry. I actually think that test is ridiculous. The knowledge that they have to know, I feel like it's trickery. I mean, it's a lot like boards were. But if these are volunteers coming in and they want to do this, they go through all the classes, they take the written tests that they have to do, they take the clinical part of it, and then they can't pass the National Registry. You're not going to get volunteers because of this. I mean, this is going to deter people. It actually makes me very sad because in our area, that's all we have. We're an hour from a hospital either way. And we need this service. And there are people retiring, but there's not people that are able to replace. They want to do it. But I'm huge with this National Registry. I don't know who makes those tests, but I think that needs to be looked at.
If we know that our pass-fail rates are low, and we know what the test entails, really, so then really, if we have a poor pass rate, who is that on? Is it on the students not paying attention, not studying, not doing what? Is it on what the educators are actually teaching them? Are they teaching them the information they need to pass that test? Obviously, if we only got a 30% pass rate, they may not be teaching them the right information. Maybe they're teaching them good information, but it's just not the right information.
I think
You know,
it comes-
obviously if
it comes down to more of the questions themselves that are on this test.
Yes.
The questions are poorly worded and multiple answers.
Yes.
People, they go to the gym, they go to church, they go to the bar and talk about how they didn't pass this National Registry 3 times. They took all these hours of class and we didn't pass and we didn't pass and we didn't pass. And everybody's looking, well, I'm not gonna do that then.
Exactly.
I can tell you that it's not the educators. I mean, they did a great job educating, and the tests that we had to take for WITC were great.
It doesn't matter what book we both use, we're still teaching the state of Wisconsin curriculum. Where's the National Registry curriculum then? Because that's the same thing. I gotta tell my students, this is what you're gonna do for the state of Wisconsin, this is what your book says, this is what I know in the field. And for National Registry,
Good luck.
there's 2 questions, and here's what I would pick, but I don't really know if that's the right answer.
You know, I think at least at the EMR level, the colleges, we're already trusted with their practical skill assessment. I see no reason why that burden should not be put on us by the state of Wisconsin for that cognitive exam as well. But I think that EMR level, especially when we look at the roles that they serve our communities, they are our firefighters, they are our people who are already embedded in our community, and I think it's, the state's already put the trust in us. I can certainly generate a test, whether, like Mr. Jim will testify, I'll write an easy test. One of the things is that we are trusted by the state. They should be trusting us, at least at the EMR level. I mean, I've had a PA take my class, and he's like, Joe, that is the dumbest thing I've ever seen.
I'd like to go off on what he was saying about education. I think that if there were bridge classes offered from EMR to basic and basic to AEMT, I think that we might have some of our EMRs want to step up to become basics, to do more, you know, without having to take the whole 180 hours again, you know. Learn what they've already learned and then tack on 80 more hours. If you're basic and you want to learn IVs, then you just have to take the IV portion and go and do that instead of having to take it all over again and then go do your clinicals.
Have you ever looked at models that would try to tap high school seniors before they're gone? You've got the model, you've got the schools that would be bringing the education to them, maybe exciting them into what's going on, would allow them to participate in their community this summer after they graduate, and hopefully wherever they go, bring that also.
And I think another piece of it could be some community paramedicine and community EMT work to help catch the people that are falling through the cracks, working with the community health nurses that are already being over impacted with the multitude of people they have to deal with, so that we're getting people to catch those that are taking their meds wrong accidentally, or having trip hazards as they're coming home from the hospital, and then we're out there 10 times the next week because they just got released with a COPD exacerbation, and now they're just having issue after issue after issue. So we could reduce some of the call volume by getting more people that, call 911. All right, I could have someone out there in an hour to look at this, or pre-schedule some of that.
I need to get naloxone for my ambulance and got to spend a lot of money on it. But I can walk into a business, walk into a place, say, I've got an addict in my home, and they go, oh, here, take all this, it's for free. Give me the drugs for free. And I'm going to use it on my ambulance for those of the same family members. But I'm going to have to spend the $85, the last ones I've paid. If I tell them I'm a drug addict to these free distribution places, I can get it for free. But if I'm wearing my ambulance jacket, they'll ask, because I tried, you're not doing this for your ambulance, are you? Oh.
Maybe.
And then my boss got a call, says, Dan was over getting, it was just bad all the way around.
Why is our reimbursement so bad that we can't even break even?
Probably 45% of our payers are state aid. It's a reality.
That's right.
So how are we supposed to staff our medic ambulances? Because we're trying to progress, we're trying to give the best service we can and get paid nothing. We're trying to be competitive, we're trying to pay what the cities are paying, but the state is putting stipulations on it. Then we miss one, we have 48 hours to submit that to MTM. We miss it by an hour, we get a fax back, sorry, you're not getting paid for that at all. It seems backwards.
If I go on a fire standby tonight with the city of Washburn, they got a big house fire, and we call in 3 fire departments, and we got 30 firefighters running around. The next morning, they can all go down to the Timeout Cafe, and I go, boy, were you at that fire last night? Yeah, that was a pretty bad fire. Oh, my God. And look over at the EMTs and go, did you take care of that burnt person? And I gotta go, I can't even acknowledge I was there, that I was on the call, because of HIPAA confidentiality. So I can't talk about it. I can't camaraderie with 20, 30 people. It's 1 or 2 of us, or 2 or 4 of us, or whatever. So we can't network that way.
Yeah.
It's always hard. The public has no idea. We went through our contract negotiation in our county, and it took a year, and it was in the paper all the time. You could go into the grocery store and be like, do you know the ambulance service that comes for you if you call 911 now? And they're like, some white truck? I don't know. So there's a public perception that keeps us from being at that professional level too.